Washington state legalized medical cannabis in 1998. Recreational stores are not required to be endorsed for medical sales. An endorsed store must have medical cannabis consultants on staff, have DOH-approved product available for sale, and must be able to enter qualified patients in the medical cannabis registry. 420 Friendly has been endorsed since 2016. There are 12 qualifying conditions that have been identified by the state of Washington where patients may benefit from the medical use of cannabis products. Multiple sclerosis, MS, is a chronic autoimmune disease that affects the central nervous system. In MS, the immune system mistakenly attacks the myelin sheath, a protective fatty layer that covers nerve fibers. This damage disrupts the transmission of nerve signals, leading to a wide range of symptoms. MS is a qualifying condition for obtaining a medical cannabis authorization in Washington state. This allows patients to legally possess and purchase cannabis for medical use, including for managing symptoms related to MS and its treatment. The Washington DOH oversees a voluntary medical cannabis registry. Patients can get a medical cannabis card from a medically endorsed retail store after receiving a qualifying authorization from a healthcare provider. Registration offers benefits such as excise and sales tax exemption on medical compliant products. A link to our video on how the database works and what you need to know about the benefits of having an authorization will be featured at the end of this video, or you can find it under the playlist Medical Cannabis. The program allows a qualifying patient to name a designated provider to purchase and/or grow cannabis on their behalf. Designated providers must also be registered and hold a recognition card. Cannabis may help manage some symptoms of MS, such as spasticity and pain, by interacting with the body's endocannabinoid system. While many patients report benefits, scientific evidence is mixed, and its effectiveness depends on the specific cannabinoid compounds used and the method of delivery. Symptoms that may be improved. Spasticity. Evidence suggests that oral cannabis extracts and mouth sprays can reduce self-reported spasticity. Spasticity is muscle stiffness and spasms. Pain. Both THC and CBD have pain-relieving properties. Some studies show that oral cannabis extracts and smoked cannabis can help alleviate neuropathic and musculoskeletal pain associated with MS. Sleep problems. Insomnia is a common issue for people with MS. Strains containing THC may help improve sleep quality due to its sedative effects. Bladder dysfunction. Some studies suggest that cannabinoids may help with bladder urgency, incontinence, and frequent urination, though findings have been inconsistent. Fatigue and depression. Research suggests that CBD may help reduce fatigue and have antidepressant-like effects in some patients, potentially improving mobility. Nausea. For those experiencing nausea as a side effect of MS medication, cannabis has known anti-nausea effects. It is crucial for patients to have an open, non-judgmental conversation with their care team about cannabis use. This ensures they are aware of potential drug interactions and safety concerns. Because state and federal laws on cannabis differ, it is important to understand the regulations in your location. Certain terpenes may help manage multiple sclerosis symptoms like pain, inflammation, and anxiety, often by working synergistically with cannabinoids in cannabis through the entourage effect. Research on cannabis terpenes for MS is still developing, but specific terpenes show promise for symptom management. Limonene. Abundant in citrus fruits, limonene offers anti-inflammatory and antioxidant benefits. Research suggests it can be neuroprotective and help with inflammation in conditions like MS. It is also known to help elevate mood and combat stress. The mood-elevating and anti-anxiety properties of limonene can help combat depression and improve mood. Examples of strains high in limonene include Kush, Jack Herer, Super Lemon Haze, Cinex, and Wedding Cake. Beta-caryophyllene. This terpene has potent anti-inflammatory and pain-relieving effects. It selectively targets the cannabinoid receptor type 2, and animal studies show it can help reduce inflammation and motor paralysis associated with MS. It may also help with depression. Examples of strains high in beta-caryophyllene include Bubba Kush, Sour Diesel, gelato, chemdog, Death Star, and GG4. Linalool. Known for its relaxing and sedative properties, linalool also has strong anti-inflammatory and pain-relieving qualities. Besides helping with pain and inflammation, its sedative effects can be beneficial for managing anxiety, stress, and insomnia. Examples of strains high in linalool include Do-Si-Do's, Lavender, Skittles, Grand-Daddy Purple, and Amnesia Haze. Myrcene. This terpene has strong analgesic, pain-relieving, and anti-inflammatory properties, with sedative effects that can help with pain and insomnia. Myrcene works particularly well with THC to enhance its sedative benefits. Examples of strains high in myrcene include Blue Dream, Grand-Daddy Purple, Grape Ape, White Widow, and Tangy. Pinene. Found in pine needles and rosemary, both alpha and beta-pinene have anti-inflammatory and pain-relieving properties. Alpha-pinene may also increase alertness, while both forms have shown potential for sleep issues and neuroprotection. Examples of strains high in pinene include Dutch Treat, Blue Dream, Jack Herer, Harlequin, and Strawberry Cough. Humulene. Studies show that this terpene has anti-inflammatory and pain-relieving properties. Examples of strains high in humulene are Death Star, Sour Diesel, Dog Walker OG, GG4, and Headband. Bisabolol. In addition to its anti-inflammatory and pain-relieving effects, this terpene can enhance the skin absorption of other topicals. Examples of strains high in bisabolol are Candy Kush, OG Kush, Headband, Ice Cream Cake, and Harley Sue. The two most studied active compounds in cannabis are tetrahydrocannabinol, THC, the psychoactive compound that can help with muscle control, pain relief, and nausea. Cannabidiol, CBD, a non-psychoactive compound known for its anti-inflammatory and analgesic, pain-relieving, properties. More research, including human trials, is needed to fully understand the endocannabinoid system, phytocannabinoids, terpenes and flavonoids, their effects, benefits, and optimal usage. How they all work together and in what combinations. While progress is being made, it is important to always consult your doctor before using cannabis to treat any medical conditions, as it may interact with other drugs, particularly those affecting the central nervous system or metabolized by the liver. It is known that certain cannabinoids may enhance the effects of blood thinners and sedatives, and it could potentially alter the effectiveness of antidepressants and immune modulators. Thank you for joining us. We hope this information has been helpful and that you'll join us as we continue to explore the potential benefits of this amazing plant. Please hit that like and subscribe button and leave us a comment and let us know if there are any other topics you'd like us to cover. Until next time. Peace.